Your patients may be surprised to know that enlarged veins around the ankle are often caused by leaky veins in the groin or at the back of the knee. It's a condition called superficial venous reflux. In this video, I'm going to explain why varicose veins and spider veins around the ankles are so significant and important, and what you should do about it. I'm going to cover the main cause, how they can be treated, and what you should tell your patients. Hello, my name is Dr. Haroon Gadraj. I'm a vein specialist with years of experience of running a successful private clinic. I'm here to offer training, mentoring and coaching to healthcare professionals who run their own clinics and private practices, not just those who are involved in veins. Let's get started and stay to the end, where I will share the number one mistake many vein specialists make when injecting ankle veins. So what's the main cause of ankle veins? Well, in some parts of the leg, spider veins don't have any underlying cause, and we call them idiopathic. That's really just to hide the fact that we don't know why they occur. There may be other factors such as hormone status and hereditary, but in truth, we don't really know what causes idiopathic spider veins. However, at the ankle, it's a different story. In the majority of cases, the ankle veins are caused by superficial venous reflux. And let me explain what I mean by this. The superficial veins join the deep veins at various points along the leg. And the two most important sites of these junctions are the saphenofemoral junction in the groin and the saphenopopliteal junction at the back of the knee. Blood is prevented from flowing out of the deep veins and into the superficial veins back down towards the foot by the action of valves. In a condition called superficial venous reflux, the valves at these junctions and within the superficial veins themselves are not functioning properly. In superficial venous reflux, blood flows down the superficial veins in the wrong direction, back down towards the feet. This back pressure damages the valves further down the leg and stretches the veins under the skin. Varicose veins then develop. The ankle area is particularly vulnerable to superficial venous reflux, and the skin bears the brunt of the superficial vein reflux. It's one of the first places that you see spider veins appear, and then varicose veins develop later on. In this photograph, there are lumpy veins around the ankle, and there's also ankle swelling, which we call edema. So how can varicose veins and spider veins around the ankle be treated? Well, the treatment of lumpy veins around the ankle with swelling is based on a duplex ultrasound scan. The superficial venous reflux is then treated in line with national guidance, and in the United Kingdom this usually means endovenous laser ablation. In this photograph you can see that the successful treatment of the abnormal reflux has resulted in the resolution of the varicose veins around the ankle and the dispersal of the ankle swelling. In addition, this patient had less discomfort and her risks of complications were reduced. It's always better to intervene at an early stage before the skin has been damaged. Early treatment provides an improvement in the symptoms, such as aching and throbbing. It also results in an improvement in the appearance with shrinking of the bulging veins and fading of the blue veins. And it also leads to an improvement in the health of the leg and the skin around the ankle. So what should you tell your patient who has ankle varicose veins and spider veins? Well, firstly, you should tell your patient that they don't have just a cosmetic condition. Tell them that they have a medical condition and they should have it managed by duplex ultrasound scan in the first place. Secondly, if the scan shows superficial venous reflux, tell them that this should be treated, and in most cases this should be endothermal ablation, either using radiofrequency or endovenous laser. But you should note also that superficial venous reflux in the truncal veins can be treated very effectively by ultrasound-guided foam sclerotherapy. In my experience, after a detailed explanation of their condition, and after treatment of the superficial venous reflux, the majority of patients get an improvement in their in the appearance of their legs and ankles, and they don't want anything else done. A small minority want cosmetic treatment by sclerotherapy afterwards, and that leads me to the number one mistake you should avoid if you start injecting ankle veins, particularly the blue veins and the spider veins. Don't inject too deeply. You may inject a neurovascular bundle with disastrous consequences. And I have a video about this which you can see in the description box below and in the link above. Now, if you found this information valuable, please consider hitting the like button. It really does help my channel. And please check out all the links in the description box below. Why not subscribe, and that way you won't miss my next video? Why not leave me a comment or a question? I look at all of these, and I promise that I'll get back to you as soon as I can. Thank you for staying to the end, and thank you for watching. I look forward to seeing you again soon.